We're talking about a sensitive topic today for the guys in your life. We've got Steve Lynch, who's a urologist at LDS Hospital, who's here with us. We're glad that you're here, Steve, because we're talking about prostate health. Right. And you're the guy who knows all about prostate health.
We see a lot of prostates. So.
I'm sure you do. For all of our women viewers out there watching, how serious is this when you talk to the men in your life?
Well, you know, prostate cancer is real common. And to kind of put it in the ballpark that maybe women can understand is that a woman's chance of getting breast cancer is about the same as a man's chance of getting prostate cancer.
Really?
It's about 1 out of 6.
But we don't talk about it as much. Why?
Because it's the prostate. Nobody wants to talk about the prostate.
It always feels like that's one you just want to dial back just a little bit.
Well, are you uncomfortable even right now? Is this a little bit uncomfortable for guys?
Well, when you hear about prostate, you have to figure out, okay, what else goes into the prostate? You don't really want to have somebody messing around in there, you know? But this is one of those things that is something, as you said, 1 out of 6. We need to start thinking about it, of course. And you were mentioning this to me before we got started, that there's a lot of women out there who help their guy get their prostate healthy.
Right.
So what do we need to do? If we were one of those guys who said, like, you know what, I need a little kickstart.
So the main thing, if you look at what you need to do to keep your prostate healthy, it's very similar to the same things you do to keep your heart healthy. So you need to exercise. You need to, eat a diet that's low in red meat. A good diet to start with is the Mediterranean diet. The Mediterranean diet is a diet which will allow a lot of unsaturated fats. It'll allow fish. It rarely allows red meat, but a lot of fruits and vegetables and nuts. And the best thing about that diet is that it's pretty broad, and so it's easy to stick with. It's not like a fad diet where you say, well, I'm going to do this for 6 weeks, but I'm not going to be able to stick with it. This is a diet you could stick with.
It's a lifestyle. It's a heart healthy, it sounds like, almost diet.
Right, exactly.
For your heart, too. Dr. Lynch, when should you start thinking about this and eating this way? Do you have to be in your 50s or 60s, or should you start now, like in your 20s, 30s, 40s?
If you're a millennial like me, where do you start?
Brian's really young.
How soon do you begin?
Is it
too late. No, so the earlier the better. For red meats particularly, and this is more with colon cancer than with prostate cancer, but for red meats, it can take 20 years for that process to show up in the colon. So what you've done 10 years ago, 15 years ago does have an impact. The worst meats to eat are the processed meats like hot dogs and the ones that have nitrites.
So those are the ones that taste the best.
That's right.
Right?
Yeah. The tailgating food.
Now, speaking of that, you're mentioning that there's some things you don't realize are as bad for you. What's the myth versus reality out there for things we should or shouldn't be eating to help our prostate health?
Well, so the things that you should be eating, lycopenes is a substance that's supposed to prevent prostate cancer. And
wait, what is that?
Lycopene.
What is a lycopene?
So a lycopene is found in tomatoes, pink grapefruit, apricots. But the tomatoes in particular have a high content, but it has to be a cooked tomato, like tomato on a pizza or a stewed tomato. It can't be a raw tomato.
That's interesting. Yeah. There's a difference between those two. You also mentioned fiber. That's an important one.
Yeah, so fiber is important because it reduces your risk of both colon cancer and prostate cancer. But the other reason that fiber is helpful is that it kind of levels out what you eat. So if you eat a lot of sugar, while you take fiber, it levels out the sugar content in your bloodstream. It levels out the cholesterol and the lipid content in your bloodstream. And so it will keep you fuller longer and will help you to lose weight and to exercise and get a more healthy lifestyle.
I like the sound of that. You want to make sure you're healthy.
Well, we had a couple others on the screen if you were just watching. Number 2 is omega-3 fatty acids. I'm thinking fish when you say that. And also number 4 you mentioned is vitamin C.
Yep. So vitamin C, particularly in the form of cruciferous vegetables, and that's like broccoli, cauliflower, kale. Those tend to have high vitamin C, and they seem to reduce prostate cancer as well.
There you go. Steve Lynch here from LDS Hospital. Where do we go to get more information, Steve?
You can contact the LDS Hospital, and we'll send some information out to you if you'd like. We've
got it online, too.
Right. But prostate healthy is similar to heart healthy.
I like it. Good tips from you today. That's their website, everyone. We just put on the screen. We can link you from ours, and ladies, nudge. Do that little gentle nudge into healthy eating for all the men in your life.